So allopathic medicine, yes, score, like we are both alive because of it. And then we get into the point where she's having all of this like goop and drainage and nasty whatever. And the doctor's like, she's fine. She's fine. Like, I don't think she's fine. The pediatrician told me at one point when it took them 4 hours to call me back that they were trying to have a life. It was like, and you're the pediatrician on call. So don't be on call if you don't want to do that.
You're listening to the New Age Human Podcast, where we have mind-expanding conversations around science, spirituality, and alternative health to help you unlock your true potential and thrive in a rapidly changing world. My name is John Astasio, and I help entrepreneurs and professionals manage stress and uncover inner obstacles so they can next level their success, whether that be financial freedom or living a happy, fulfilling life. Now, with that said, let's get to the show. All right, we have Sara Cotterill in the building. Virtually. How's it going?
It's great. How are you?
I'm doing good. For anybody that's watching, just show the mug real quick. We just need to, like, what does the mug say?
The mug says, let that shit go.
There we go. So if you're stressed right now and you're just tuning in, just let that shit go. We're going to be talking about, obviously, human potential and how we can better develop ourselves. And today we have Sara on because actually she has had a front row seat to the healthcare world, being an attorney for the industry. Let's pick her brain, because if she's on the show, that means that she saw stuff she didn't like and is doing something different about it and is wanting to make it change. Is that correct, ma'am?
Yes, that would be 100% true.
So with a front row seat, like, what did you see? What was it like being an attorney in the healthcare world?
So I'll back up for you a little bit because
Sure.
I went to college thinking I was going to be a physician. Like, yes, this is where I'm going. This is what I'm drawn to. And then organic chemistry hit, and I was like, okay, maybe not. And did the kind of, maybe I'll go into business. I don't think so. I'll be a history major. So I was a history major and went to law school. And coming out of law school, decided I wanted to work in the healthcare system in a different way. So I got into healthcare, corporate, and regulatory work. So it means I helped physicians and hospital systems and everybody across the medical spectrum with the business side of things. So I really wasn't in a courtroom, but I had a lot of exposure to doctors, their employment agreements, their business arrangements, how hospitals worked with insurance companies, how physicians worked with insurance companies, and that whole realm. So anything that really had to happen from the business perspective, I ended up getting involved in.
You know what? Something popped up on my social media feed as I was death scrolling. And there's, I think it was a physician. And he was like, you know how they have they talk to themselves, but they're pretending they're different people. And his alter ego said, is it true that doctors or physicians work for the insurance companies? Like, are you technically working for the insurance company? And he's trying to defend himself, but at the end of the day, it's like the insurance company chooses how much to charge you and how much to pay you. And can you shed some light on like that relationship on how maybe your average person thinks how things are done when you go to the doctor versus what the reality is, and how maybe that's not in their best interest?
Yeah, it's really interesting. It's one of those follow the money type of conversations. So the incentives are set up by the insurance companies. And you can argue that the insurance companies have the motivation to keep us well. And they should on one hand, except that the system in many ways isn't set up that way. So it rewards physicians and hospitals for the number of times they see you, for the number of drugs, for how long you're in the hospital, all of those types of things. And it is trying to change on some front. It's really interesting you bring that up because before I got out of healthcare, I was at a large Midwest physician group that was mostly primary care physicians, but also some specialists. And we looked around and we said, okay, it is not sustainable to kind of do what we're doing going forward, just as this physician group and seeing patients. So, what's our next step? And we asked ourselves who our client was. So, is our client as the company the physician? Is it the patient? Or is it the insurance company? And we went round and round and round and had lots of interesting conversations on it. And for us, we decided that our client was the physician. Because if the physician had what they needed, if they were supported in the way that they really felt was best to practice medicine, then guess what? Patients got the best care and insurance companies got what they needed, wanted in the long haul. And so that then led us to say, okay, well, we need a partner. And we went out into the world looking for who that right partner was to talk to venture capital, talk to hospitals, and ended up partnering with Optum, which is a subsidiary of United Health Group, which is a Fortune 6 insurance company. So I've seen it from lots of different angles for sure. Um, Now, one of the things that's starting to happen in medicine is something that's happening in Medicare Advantage, which is where insurance companies are really trying to incentivize physicians, patients, whatever, to be healthier, stay out of the hospital, do some of these more preventative care type of things. And that is such a small segment of our healthcare world. And you have to elect into that program
Mm.
um, that it's really not working. So, a lot of what happens in day to day medicine, and I think most people that have been to the doctor lately can attest to this, right? You maybe go because it's your like annual physical, right? Like I have to go once a year. So I set this time up. God forbid I have to like change it because then I can't get in for another 3 months. And I get in and I go, okay, you run all these tests, and the doctor talks to me for about 15 minutes. Yep, yep, yep. Check, check, check. Looks good. Move on. Go.
Mm.
And I'm still left going like, what? But there are all of these things and I don't feel quite satisfied and I'm not really feeling good, but you're telling me things are fine or take this other thing. They're like, "Oh yeah, come back in another 3 months for another 15-minute visit."
Like a car checkup, like getting your missions done.
Yeah, exactly.
Just wait, and then they're like, "No, you're good. We checked it out. But can we talk a little bit longer? Like, there's other stuff."
Right. I'm not feeling good. And this is the interesting part of medicine because on the flip side, we have AI
Mm-hmm.
coming in, right? And as of 2020, medical knowledge doubled every 73 days.
Ooh.
73 days. So you cannot know it all as a physician. There's no possible way. Um, so now we're like, oh, AI's here. Okay, great. We'll send patients home with every monitoring device you can imagine, right? Your temperature, your breathing, your weight, your EKG, and the list goes on and on and on. And then what's starting to happen is AI is making the recommendation.
Mm.
And the physician's going, yep. And AI is oftentimes more accurate, actually, because it has the information. It doesn't have these personal biases that we have. And yet, I think we're really missing the human connection
Yeah.
in medicine. Um, and I think it's going to cause us problems in the future.
I like how you brought up AI because that's a hot subject for the past few years, and it's just getting more and more like in your face, right? I mean, at the time of recording, it's like November of 2024, and two of the most biggest cell phone companies, Apple and Samsung, just this year launched their phones fully integrated with AI. So now everybody default is going to be engulfed and actively day to day being exposed to AI. And then now I do feel like you said, having AI introduced to the medical field as a big part of it. Yes, um, no one physician is going to know all the answers. And then you have all these diagnostic tools. You have your watch now, you have the ring, you have the headsets. I mean, we're talking about monitoring your brain waves. And I tell everybody, like, it's a two-way road. I mean, if it can read your mind, it can also start throwing stuff in there, right? Um, because if you understand anything about like frequency and waves, for something to for it to work one way, it has to be able to work the other way as well. Like that's just the nature of frequency, right? What are your thoughts on like the tracking of everything, right? Versus somebody, or maybe even better, because healthcare, right? I think you said it really well when we were like off camera. You said it's what was that phrase? It's healthcare. Healthcare is not healthcare. It's something else.
I always say health is neither health nor care. It's a disease management system and a poor one at
Mm-hmm.
best at
So
the
the
moment.
AI is going to essentially be empowered to manage your disease.
Yeah, and I think it's like anything, right? Like your biggest strength is your greatest weakness. And I AI can spot patterns like nobody's business, right? And it will definitely see things that we haven't seen, that we don't know. And yet there's this disconnection that starts to happen. And if you think about it, like machines are getting really good at being machines. We need to get really good at being human. And
Mm-hmm.
so what happens in the medical field, take AI for example, we had this happen to us where we were really encouraged to put in a call center that AI was answering those questions, right? So you get the patients, they call in and they get the basic like, doot, 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 this is what can happen. Um, well, sometimes we had one patient that called in, you know what they needed? They needed an air conditioning unit. AI at this point is not going to come up with they need an air conditioning unit. And when we had the actual nurse answering the call, they could put all of those different things together. They had the ability, the authority, whatever to say, like, oh, okay, if we get this patient an air conditioning unit, then all of these issues will basically subside. Let's spend money on that instead of all of these other pieces and parts.
Yeah, right. And I like how you said um, humans need to be more human. And I feel like that is going to be a pro to us using AI, if you were to think of a pro, a positive thing, because the AI is going to make it very obvious about, it's going to make it very obvious how valuable being a human is. And we're going to know more about ourselves because we are understanding more about what we're not. And I think it's very interesting to like just watch that happen because I can speak, right? And like just like that, what I just did, right, where I stuttered and I made a mistake, that is something on a deeper level necessary to experience with other humans. If someone's perfect on stage with like there's no shading to their teeth and nothing's crooked, and it's weird. It's very weird to see someone that's like perfect. There's like it's not human. And so there's like this weird flaw area that makes us more like a notch above perfect, which perfection lies within imperfection. So I like the whole idea of like toying with like this that realm of questioning things. So we're definitely getting going deep into that area, but bringing it back, uh, in your experience of being in that field, an attorney, and um, seeing how people are being treated as patients, I'm sure you saw things that made you question what you were doing, question the industry, and start to move out of it because you're not doing that anymore and you're doing something more on the other side. So, could you enlighten us on what you saw that made you say, you know what, I'm done with this? And then we'll go into what you're doing now because what you're doing now is awesome and I want everybody to know about it. But I want to know like people need to know like what's going to cost someone like yourself in that position to make you make those changes.
I think for me, it started to come down to a breakdown of trust.
Mm,
I started to not feel like I could actually trust the physicians or trust the healthcare system to help me heal or create health. And that happened maybe slowly over time with some of my own personal issues. My daughter, um, and was born with the cord wrapped around her neck 3 times. So allopathic medicine, yes, score, like we are both alive because of it. And then we get into the point where she's having all of this like goop and drainage and nasty whatever. And the doctor's like, she's fine. She's fine. Like, I don't think she's fine. Um, the pediatrician told me at one point when it took them 4 hours to call me back that they were trying to have a life. He was like, "And you're the pediatrician on call. So don't be on call if you don't wanna do that."
Mm.
And I started to have to go outside of the traditional healthcare system to solve those issues for my daughter, which had ended up being candida and overgrowth of yeast in your system. So treatable, but traditional medicine wasn't going to get there. You start to learn about the flu shot, right? Oh, it helps men, I can't remember the exact age, it's like 47, have the flu for an average of 2 less hours, and yet we have to get the flu shot, right? And then, like we already talked about, I saw that these physicians didn't have the time, didn't have the energy to actually get to these root cause issues for their patients, and on the flip, I'm hanging out with the doctors all the time, and if you like want to get well and you're like, "Ooh, I want to get healthy. I'm going to go to the gym. I'm going to start building muscle. I'm going to start lifting weights." And you look around and you think, "Ooh, I want a trainer." Right? You don't go to the guy that's sitting eating a giant bag of Doritos, um, who's got, the fat rolls and the jiggles and all of that, right? Like you go to the person that's got the muscles, they're doing it, they're motivated, they're going. And that's what I started to think as I looked around at some of these physicians. They went into this profession, I would like to think, to heal people. And yet they weren't healed themselves. They weren't even on a journey of healing themselves, right? Like I start to think about in my world these hallmarks of vitality, and yet the majority of physicians were showing up with hallmarks of disease or dis-ease.
It's funny to go to like your physician and outside you see a couple of other physicians and nurses like smoking and like on their smoking break. And I got a story for you. My wife and I, we were trying out, we went vegan for a while, but we were like in the beginning stages. And she had something that was like carpal tunnel going on. She was having issues. And so I'm like, you know what? I heard if you go vegan, helps with inflammation. Let's just try it out. And within 2 weeks, her wrist was fine, but there were other things that were going on. Not, you're not just like superhuman. Your body has to process stuff, and depending on the extreme change, you're gonna, get these purging symptoms of detox. But so we weren't feeling well one day, and so we went to our physician. And the guy was like, "Have you had any changes to your lifestyle?" And we're like, "Yeah, we went vegan." And then he looks at me and he goes, "What are you, a bird?" I'm like, "Did he really just say that?" We never that we never thought he would say that. Meanwhile, he's overweight. He's got like the patches under his eyes, and like he obviously just clocks in and just is more of a container of data. And he's definitely not on a journey. He's on a different journey, a more negative journey for his health. And so we were just like, all right, that was it. That's we needed to hear that. Thank you very much, sir. We're not coming
Yeah.
back.
It was interesting in a lot of the physician meetings, I would start them out by saying, "Okay, when I'm talking, we're gonna stand up." Which I'm sure was annoying, right? Or we're gonna do this deep breath or this movement because we've been sitting for 2 hours, and nobody's meant to sit for 2 hours. Or I'm gonna replace the, like, donuts and sugary junk with less sugary junk. So, yogurt and fruit, which is not perfect by any means, but still feeding people. Um, or I'm gonna mix up who sits at what table when we're all together as a large physician group. And I mean, some of the reaction from those doctors, I will not sit with people I don't know.
Wow.
So it's fascinating. And it reminds me like we're all people and we're all, like you said, on this journey. But what modern medicine has done is removed our belief in our innate abilities to heal. And it's disconnected us from our own discernment of saying, okay, this feels right to me. And this feels like the next right thing to do. And AI is a part of that too. When you think about it, like we are built to read the expressions of people.
Mm-hmm.
Um, the the voice inflections, the forehead wrinkles, the all those little things. And so number one, when you add in Botox and stuff like that, it makes it much harder to tell. And then when you get a perfectly crafted, whether it's AI or whatever, all of a sudden our ability to use that discernment muscle and know the truth is out the window. And so we're left going like, um, I don't know. I don't know what to do. I don't know who to trust. I don't know how to be. And oh, by the way, it must be that I need to go to my doctor so that they can tell me, do this, take this in these exact steps, and I'm just going to trust it. And that
Mm-hmm.
started to really bother me.
That discernment piece is huge nowadays. From it's like a huge need right now for obvious reasons. You have a lot of distractions, a lot of, I call it peacocking. Everybody showing their best selves in every aspect of their life to try to sell you on some aspect of them, and a lot of deception out there. So on that subject, you left that industry, and can we go into what happened next? And I think you had a funny story on how you left, but like, what did that look like?
I mean, I left. It was a little bit of a dark night of the soul, if you will. We've all had them.
Hmm.
Um, I haven't had any near death experiences. I don't come from a lineage of gurus. I'm not ordained in any religion. But I did have that bona fide dark night of the soul for a period in my life. And it was one of those kind of slowly coming and then all of a sudden where it was like, nope, this is not happening. And a couple of things broke down all at once in my world. And I feel like the universe gave me a swift kick in the rear and said, mm-mm, you will be doing something else. Um, and so I left.
Mm.
And then I went, oh boy, okay, what now? Because I think we always, and at least I experience this, like we define ourselves by what's on our resume,
Mm-hmm.
right? I went to college. I did this. I am a lawyer. I've worked with these places. And then when you're like, oh, well, what am I now? Where's that worth? Where's that value? What do I do? And so I didn't do anything for a little bit. And everybody in my world was like, oh,
What's going
you're going to
on?
have to teach yoga because I've done yoga for a long, long time. And he was like, I don't think I'm going to teach yoga. You need to get back into the legal world. You need to post your resume on all of these things. You need to, you should, you should, you should. And I went, I'm not going to do those things. And as scary as that was, and I had one woman that had kind of recently come into my world as a career life coach. And she said to me, all you have to do is don't do anything that feels heavy.
Mm.
And I live my life by that to this day. Don't do anything that feels heavy. And it doesn't mean we don't work hard. And it doesn't mean we don't like get up early and do the things. But there's a difference between working hard and it feeling like this weight.
Yeah.
And so I talked to people. That was really what I did. I listened, I talked, and anybody that was doing anything interesting, I was like, I want to know more.
Mm.
Tell me more. And it really led me into, I think, where I was already going when I left healthcare, but this path of regenerative health and wellness. So, what we put in and on our bodies, our innate ability to heal, um, exist. They matter. They make a difference. And those are the things that allow us to show up with vitality.
Got it. So you got into regenerative health, and could you go a little bit more into what that looks like? And I know that you have a community that you have right now and a whole system. Um, I'm actually curious, is that part of that community and is it attached to that or is it something completely separate? And are you willing to go into that science? Because I'm sure everybody listening is like, okay, so what's this regenerative health stuff?
Yeah. So let's define regenerative very basically. And I like to use this analogy. So I live in Indiana, where Indiana University has this race called Little 500, and all the fraternities and sororities ride around on this cinder track, right? And if
Hmm.
you fall as a rider on that cinder track, it's nasty. So if you think about it, if you're riding that race and you're going and you fall, and a month later, you look at that big scab on your arm and it's worse.
Mm.
That's degenerative.
Hmm.
If a month later, it's exactly the same as the day that you did it, it's sustainable. If a month later, it's healing, it's scabbing over, it's starting to improve, that's regenerative. So regenerative is this like continual growth, continual evolution. And as I look at it, there are certain um, definitions within that. So you have to get into like a regenerative living system. We each are, like our bodies are. That's nested inside our family, which is then nested inside our community, which is then nested inside, and it gets larger and larger and larger to the earth, the universe, and
Hmm.
you can go on. But each of us within our own regenerative living system have our essence, something that is so us at its core. It's kind of that unique fingerprint of this is our unique essence. And at the same time, we're interconnected, right? I can't be me without your reflection of me
Interesting.
or the people in my world. And so the list kind of goes on and on and on. And in the biohacking world, there's a lot on this regenerative medicine. So stem cells and things like that, right? Like that's not really the way I use it when I'm talking about regenerative medicine. I'm back to, oh, by the way, your body is equipped to do a whole bunch of healing if we really tap in. And so instead of these life hacks, can we just have life, right? Like we don't need to hack everything. And so for me on this path, I got into the farming side first of
Mm.
it, because it goes back to what we put in and on our bodies. And our food isn't grown in nutrient dense soil, then our food itself doesn't have the nutrients. So it can be organic all day long. Organic is basically just a list of chemicals that aren't sprayed on the food, whereas regenerative is really much more about being a soil farmer. And so we're creating that diverse ecosystem within the soil. And oftentimes there are things like a cover crop or not plowing. And you hear this like, don't plow. The reason for that is if you think about your house, right? The soil is this beautiful, almost like coral structure. But if you think of your house and it has all the furniture in it, and then once or twice a year, somebody comes in and flips it upside down and shakes it, and then everything goes like and smushes together. That's what's happening with the plowing. So it's so much more than just don't put these things on. And what
Mm.
we see is that food has higher nutrient capacity. It has more, almost think about it, it has more light energy
Hmm.
in it. And when we put that light energy into our body, then it helps our mitochondrial function, it helps our energetic function, and the list goes on and on and on. So that was my entry in, and interestingly, it came actually in the hemp world, which is not a space I ever would have foreseen that I would have ended up. And yet, the hemp plant itself is a beautiful plant. It's got this really long taproot, which helps it aerate the soil. It goes down deep. It creates that expansiveness in the pockets that the soil needs to be healthy. And so I got into hemp in the way that we grew CBD hemp. We grew hemp for seed. So think about like the hemp hearts that you sprinkle on your food.
Hmm.
Um, and then also um, hemp for biomass. So biomass could be like people are starting to make hemp houses with hemp insulation.
Oh yeah. Okay.
They're using hemp insulation in cars. They're using it to make clothing, right? And there's so many ways that that goes.
Mm-hmm.
Um,
All
and
right.
that's another industry that is full of interesting characters.
Wow. And it's interesting how you can learn a lot about yourself and life and the world around you by even tapping into that industry of agriculture because you're learning how life works. I mean, I've grown stuff in the backyard and it's really cool. And you think, I'm going to grow stuff in my backyard because I want free food. And when you grow it, you're like, it's not free, not at all. There's a lot of there's a lot of work to it. I gotta spray it, but then I gotta find the right spray. And there's a lot of work that goes into making sure that you maintain like that it's organic and then the soil. So I get it from the limited experience that I've had with my own journey of growing plants and killing them and eating from them and all that. And I like how you use the analogy of the light energy. And I love seeing those images of the plant and the life energy. I forgot what you call it, but it's just you see the light around the leaves, and then the when you pull it from like a fruit from a plant, it has life in it. But the longer it was disconnected, the less light it will have. So like ideally, just pluck it, eat it right away.
Yeah.
Um, you said there were some interesting characters, and I just can't unhear that. Can you say like what do you mean by interesting characters?
So the hemp industry is full of this gorgeous mix of people um, who a lot of them are really well intentioned and good meaning and really want to bring things like the CBD to healing people, or the hemp biomass as an alternative
Hmm.
to some of the other products that we have that are less sustainable or regenerative out there. And then you have the people that got in because they thought it was the next gold rush, right?
Mm.
We're going to make up a whole bunch of money. Um, and then you have, it may be some of both, but people that came from the legacy cannabis, the legacy marijuana industry. And because that was illegal for so long, they have a totally different way of operating. And it's a lot of self-regulation. Uh, and so some of that translates into the hemp world. Um,
That's funny.
So it opened my eyes to a lot of things. It's also a nascent industry. It's a new industry. And so there are a lot of things that aren't figured out, like supply chain. So it's not something like, oh, farmers grow wheat in this country and it all goes into the grain silos and then food manufacturers buy it by the rail car, right? Boom, boom, boom. There's always this much production. Yes, price fluctuates a little bit, but not that much. And we basically know where the demand is. In the hemp industry, even 10 years later, it's still getting figured out
Hmm.
as to what that supply and demand issue is, which makes it really a challenge if you're in the supply side and maybe in the demand side. And then you've got legislation that's always changing or threatening to change. So there are just a lot of moving pieces and parts.
Got it. And I remember hearing about some regulations being, I don't know what you would call it, like canceled out or relieved or whatever because of a strong hmm, withhold or I'm having a hard time with the words, but I just know that the hemp industry has more opportunity now, and it's another product that you can use for clothing, and there's so much more you can do with it because of what it is, and it was just held back for so many years, and I think that's why people thought it was a gold rush. I mean, I heard about it, I'm like, oh, let me see if I can invest into some help, some hemp, something hemp, like like you know, the rules are now not as strict. So let's go, let's go. But it's yeah, like you said, it's a long process. So if anybody's looking to get into that industry, just know that there's opportunity there, but it could be you might have to invest time and energy into helping that industry before it explodes. There's a lot of unknowns there. So how did you go from going into the agricultural world and um, helping with that to what you're doing now? Because I want to bring it to your community. I think that's much needed now. I'm curious about that transition, and we can start talking about that.
Sure. So I think it was part of my journey all along, is my own personal journey of how do I want to show up in the world? What does balancing look like for me? Um, and one of the pieces that I learned for my own health and healing was this like duh, but aha of, oh my God, I can't do this by myself. And I think from my like perfectionist self growing up to then going into the legal world, it always felt like to me, I was supposed to have all the answers.
Hmm.
I was just supposed to know, or I was supposed to figure it out. I was going to put out this perfect image, and that's going to be the way it was. When inside I'm going, oh God, what do I want to be when I grow up? And how do I figure this out? And, you know, trying to synergize and weave together all of these ideas and looking at, okay, why is all this stuff so complicated in our world when it really shouldn't? And if we look at ourselves like a plant, what do we need? We need light, we need some nutrients, we need to be hydrated, um, we need times of rest, we need times of growth, and carrying those pieces through. And so as I was going on this journey, all of a sudden it was like, ooh, that interdependence piece hit really strong. And I began to see more and more, both in my own world and other people, that we can't do the me well without the we.
Agreed.
And it was when I had those conversations, or when I had even those like times of tension with people, that that's where I had my real growth in awareness and perspective. And then getting into like, oh, okay, there's knowledge about this. There's a skill building that happens. And I could sit at home and I could read all the books that I wanted, or I could listen to all these great podcasts that I wanted just by myself. But if I never actually went out into the world and did them and practiced them and tried them on with other
Hmm.
people, then I was just kind of taking in a bunch of information.
That's like knowledge is power. And I usually say knowledge is potential power because you have to go out there and do something with that knowledge. I agree. Yeah. And so that brings us to your community of going out there and applying that knowledge. Like you said, it was interesting how you said um, you were in limbo and you left an industry, but now where to go? And you have all these people telling you, oh, do this because everybody has opinions. Do this, do that. I'm a guru because I did this. This helped me. And it's like, I don't want to do that. I have the skill. It's fun, but like you said, it's a little heavy for me. And
Yeah.
I feel like what you're doing now is helping with that a lot, where it's a community effort. And so you have started. I think you're the co-owner or the co-creator of the Human Array community. Let's get into that. What's going on there?
Yeah. So this is one of those like create the things that you need that are
Hmm.
looking for that you don't that don't exist. And so we created the Human Array as a platform to amplify human potential through the power of community. And there are a bunch of pieces and parts to it. But in its essence, it is starting to match the coaches and catalysts. We call our coaches catalysts with the people looking for that information. So when you go out in the world and you type in, you're like, oh, okay, there's something more, right? I want to work on my health in a different way. I'm feeling called to look something up. And you search on Google and you're like, okay, there are 5 gajillion things. I don't know where to start. I don't know who to trust. We've created a community where we've said, okay, we have vetted and brought together coaches in all different aspects. So, emotional health, mental health, spiritual health, physical health, like you name it, we've got them. And then we've said, okay, you come in as the seeker, we're going to remind you that your discernment is the most important part, that you know, and we're basically going to show up with that lantern and say, okay, you're here. Yay. Let's help figure out like what the next right step on your journey is. And so start to kind of link arms and go with the people on their path. And at the same time saying, okay, you want to start to have more energy in your day. Here is a way to drink more mineralized water, right? Water that actually hydrates you. And you may go, I'm not really into that at the moment. So we say, okay, all right, here's a way to start breathing more deeply. And you may go, oh, that feels like something I really want to get into, or no. And so we expose people and help to guide them on this journey while at the same time they're guiding themselves.
Love it. I love it. And it's much needed. It's, I feel, as you can chime in, whenever you feel, but I see it as like a big picture, right? Society's falling apart. A lot of the systems, a lot of the pillars that we grew up and spent all that time in school and doing the tests to memorize. And you're like, you get out of high school or in college, I understand how the world works. And things are changing now so fast. You're already outdated as you're learning it. And then, what's next? And then you have a lot of these gurus that are trying to tell you, well, this is what's next, and biohack this, and don't eat that. Eggs are good for you. Eggs are not good for you. No, the white parts are good. No, the yellow parts good. Maybe a little bit of both. Maybe a little bit of nothing because you're gonna die instantly. Like what? Don't Google your health symptoms, or else you're gonna freak out. And so I like how you have the community where you have vetted professionals. You have that lantern situation where you're shining the light, because yes, when you're a seeker, a lot of us are seekers. I think we're all seekers, really. We're just trying to figure out what's going on. um and if you shine the light too bright and you see everything, uh there's just a lot of options. There's just a lot of options out there.
It's overwhelming. So part of it for us is how can we start to help people create the space in their world to listen and to know? For me, it's kind of that be still and know. And instead of like, here's this, right? Like there is a method to the like, okay, we're going to come in. You're not going to see everything. You're going to start to be offered up these pieces and parts. Um, and just by coming into community, this is like what is so cool to me is people are lonely, right? A surprising number of people are lonely. And this loneliness epidemic is worse than smoking 14 cigarettes a day.
Mm,
It's worse than the obesity epidemic. Um, there are a whole lot of people in this country and in this world that don't have one, let alone five people that they could call if they need money, need to go to the hospital, have some sort of crisis. And yet we've glorified having 10,000 friends on Facebook. Um, so how can we say, okay, I don't need everybody? There are studies that show that just by being on a Zoom with a stranger, it improves your happiness.
hmm.
So we've got all of these complicated things. We've got the whole medical system that's like, do biohack this, take. And I mean, I've been down that path. I have a cabinet that is full of supplements that I've thought, like, yes, that really makes sense for me to take. Um, and at the moment, they're sitting there because I'm not really feeling like I want to take any of them. And I may come back and I may go, okay, now I'm taking a little bit more of this, or I'm doing that type of path. But can we create that space? Can we create that place for reconnection with yourself, with each other, and with nature too? That's the other piece of it. Can you get
Mm.
outside? Can we have these conversations while we're walking and talking? So you start to notice the bluebird, or the sky's changing color, the leaves are falling. Like there's study after study after study that shows that these things make a difference. And just one more, there was a study that showed that if everybody is slightly more extroverted, so you could be a total introvert and the like extra extroversion could be you say hello to the person that checks you out at the grocery. That impacts your health and well-being. So there's these such minor things, and by starting to bring people together and help them be together in that way and on their own journey, the healing and the health creation is immense.
You bring something up that is easily forgotten and dismissed, which is the emotional health affecting your physical health that I feel like a lot of people dismiss. And I can't think it off the top of my head, but they've done some interesting experiments, and you have like animals, and they're one's taking a supplement, one's having a standard diet and something another diet, but one of them outperformed everybody else, and they're like, this doesn't make sense, what's going on, like it shouldn't be that different. And they found out that the guy that was taking care of the rodents just took a liking to this one and was petting it more often, and that rodent felt very relaxed. I'm sure it felt very happy, right? I mean, I have a cat, and the cat always wants us to rub the stomach, and it stresses, she stresses out, and she does the whole clawing on like the clawing mat. And I'm conscious of that because I'm like, I need to make sure this cat is happy so that we can prolong this cat's life. I need
Yes.
to prolong, I need to be aware of my happiness so I can prolong my life. And we hear about these stories of these centurions, these people that lived past 100. And we ask them, what did you do, as they are smoking in front of you? And they're like, just don't take things too serious. Like, I'm frustrated and happy at the same time,
Yeah.
overcomplicating stuff, right?
I know we're good at that. One of my favorite studies is the Harvard longevity study. Have you heard about this one where they studied um, originally it was, I think it was almost 800 men over the course of 85 years. And what they found was that the determiner of happiness and longevity was not career. It wasn't, the title you held or anything like that. It was the quality of your relationships. So basically, the quality of your relationships determines the quality of your life. And um, the director of that study has said that in part it boils down to never worry alone.
So you need a group of people with you to worry with you. And that's better than worrying alone, which is, you need your friends so you can, just, I'm stressed, throw up on them. But yeah, that's interesting. Very interesting. Yeah, we're onto something here as a society, as people, and there's a lot more um, to this emotion thing.
Yeah, and emotions really, like, I'm a firm believer that the physical symptoms that show up in your body are manifestations of these psychosocial, spiritual, emotional types of challenges. And I don't know if you're a follower of Bruce Lipton at
Oh
all,
yes, awesome.
the biology of belief. And Bruce Lipton talks about how we operate 95% of the time in our subconscious programming. So think about how you were like, oh, I'm going to drive to the grocery. And then you're like, I have no clue how I got here.
Yes.
There are so many things that happen that way in our life. And so we have these kind of big T and little t traumas that have built up and clogged up our whole system. And if we can start to clear those out with, again, these simple types of things, can we get the toxins out? Can we use maybe sound therapy, light therapy, frequency, resonance? We'd be
Hmm.
totally different people.
Yeah. And on that note, yeah, um, I've been researching that and learning about that more recently, and it's exciting to learn about attacking that on both ends. Your stress can be related to your gut health, and then if you can do all the work you want to help with your stress, but if your physical part of your life is still not good for your gut health, you're just walking up. It's an uphill battle for you because the irony is the poor health, the poor diet, where it's messing up your gut health, is gonna cause you stress. And then because you're more stressed, you think about things that stress you, and then you're going to probably continue to eat the thing that's making you. It's just a downward spiral. So it's like um, there's not one solution fits for everything, but knowing how everything works together, I feel like as a collective, it takes more than one head, more than one brain to make that work. So a community like yours would definitely help with stuff like that.
And if you look at
Yeah.
it, our body is actually a community,
Mm-hmm.
right? Like we're more bacteria, fungi, microbes than we are human cells.
It's a freaky thought.
It's a freaky thought. And that goes into the whole kind of boundaries conversation too, right? We talk a lot about having healthy boundaries in our relationships, and we also need them in our body. So, there's a little tiny layer in our gut that separates the outside world from the inside world. And it is basically like a tenth of a human hair wide and as big as a tennis court, right? But if we eat the food, have the emotional stress, all of those things, guess what? That gut lining is almost like a dam where you start to go like, oop, there's a hole I poked in. There's a hole. There's a hole. There's a hole. And so you get that leaky gut. So even the healthiest foods are getting into us and our body's going, nope, alert, alert, alert. And I think the same thing happens in our kind of daily lives.
Yeah, the barriers of your daily life and the ability to say no.
Right. Yeah. Or this doesn't feel like it's for me right now.
Mm-hmm. Yeah, I actually I don't want to put anybody under the bus, but let's just say I know someone close to me that has had a history of a struggle with saying no. So they'll say they want to say no. They do say no, and then they say yes, but then you complain about saying yes because you really wanted to say no, and so it's more like even if you know that person is going to say yes, you don't want them to say yes. You say no for them, and it's that challenge of those boundaries, and which is huge, which circles around to discernment. So um, we've covered a lot today. And is there anything that you wanted to mention today that we haven't covered so far?
I think the thing that keeps coming up again and again in my world and that I end up coaching people on is this concept of balancing.
Hmm.
And they talk about it almost in terms of energy management. And it goes into what we're doing in the community, it goes into what I'm doing in my coaching for people. How do we start to look at the season ahead and say, okay, what are our values? What are our priorities? What are the demands on our time in all of those different buckets, like mental, physical, emotional, spiritual, and get to the point where on a Friday night, we feel good, right? Instead of the way my kids used to feel on a Friday night, which is, oh, I can't do anything. Well, actually, it usually hit on meltdown Thursday in my house where it was like, oh, I can't do anything. Or time and time again, I see people that are like, I have to go on this vacation.
Mm-hmm.
I mean, it's a crisis management vacation, is what it is. It's not a like, oh, I'm choosing to do this because I've structured my world in such a way that when I get to vacation, I have the energy and enthusiasm and excitement that I can go and have fun. Not, oh my God, if I don't get out of here, I'm going to melt down.
Right, right. Go on vacation just to pass out on the beach and get this major sunburn, right?
The beach is really good, right? Like you get all those grounding and negative ions. There's a reason you feel so darn good
Oh
at
man,
the
I love
beach.
it. And it's one
Mhm.
of those like, yeah, that's a whole nother thing where you're like, I can be in the water right at like running in and out of the waves for forever, for like the longest period of time until like my skin is like raw from like all the sea salt and like the shells scraping you. I like wiping out. Like I like tumbling around. Like I'm just weird. My wife looks at me and she's like, "Are you done?" I'm like, "No, I got sand in my ears. I got sand in places that I didn't know I had. You know, I have built a ritual before I get into whatever vacation spot. Like I have to like get rid of the sand in questionable areas. But it's like it's that experience of connecting with nature. And yeah, there's a deep, deep need for an escape from the box, from the fluorescent lights. And to your point, yeah, it shouldn't be an escape. It should be like a planned thing that you're excited about. So when you go, you do stuff. So
Yeah.
I like what you said
And
there.
this is what gets me so excited is yes, traditional allopathic medicine. Yep, we need it. There are times and places, and hopefully a very small amount, because if we start to do these things, if we start to get out into the sunlight and hydrate and ground and sleep and play and come together, we're totally different people. Like that is where the real healing and health creation comes. And if you want to amplify that, you put people that want to heal together and boom, watch them go.
Let's go. So anybody that wants to connect with you, how do they find you? What's the best place?
Um, they can find me on LinkedIn. I'm there. You can email me at Sarah, Sarah, at thehumanarray.com or go to the Human Array and just look around, join, and find us. And that's thehumanarray.com. And then technically I'm on Instagram at I am Sara Cotterill. And that hasn't been a place I check it, but I don't post a whole lot.
Got it. And then at the end of the day, if you're driving, you can always come back and go into the show notes, and we'll have all the links. So don't worry about that. But it looks like you have some interesting and exciting projects that you're working on, especially the community and your coaching. And I encourage anybody listening to connect with Sara. Sara, it's been a pleasure having you on the show. Thank you for all the statistics and your personal experience um, in the healthcare world. I think that's an eye opener that not too many people see the back end of that. Just it was an enjoyable experience to have you on. I appreciate you.
Thank you.